Hello guys, welcome to my YouTube channel Vetvox. So today we are going to deal with a new topic, that is Aspergillus, and this Aspergillus is mainly important in poultry section and you will be learning more in pathology. So let's start. So it is a disease of the respiratory system characterized by the inflammatory granulomatous and necrotizing lesions. The hematogenous spread of these organisms will be leading to the lesions in eye, skin, meninges and respiratory tract. Hematogenous spread means via the blood. Okay. And the disease is mainly caused by Aspergillus fumicatus, Aspergillus flavus and Aspergillus niger. And as I already told, it is mainly important in brooder chicks, that is on chicks. Okay, it will cause high mortality as well as high morbidity in the chicks, and in other species the intensity of the infection will be much lesser. Okay, so I will be including a table where you can see different species with different diseases, different types of diseases caused by this Aspergillus and different species. Coming to the cultivation of the organism, Aspergillus grow very well in ordinary SDA media with chloramphenicol, and you should add cycloheximide in the media because it will inhibit the growth of the organism. Then coming to the clinical manifestations, we can discuss each species. So first, in poultry it will cause acute as well as chronic aspergillosis. In acute case it is mainly seen in young chickens and it is called as brooder pneumonia, which will cause high morbidity as well as high mortality. And the typical symptoms are loss of appetite, high temperature, listlessness, gasping, fecal diarrhea. Here in this picture you can see the gasping of the chicks, and if it reaches through the blood to the brain, then it can cause paralysis as well as any CNS development involvement, causing some diseases and all. And unilocular ocular infections are mainly seen here in which, and there will be cheesy exudate in the conjunctival sac. Coming to the chronic aspergillosis, it is mainly seen in the individual or adult birds or a few birds, and these affected birds will survive for a longer period in a declining state. Okay, that is, if it is a layer, then the production of the eggs will be declining within a period of time, and the symptoms will be much milder than the acute aspergillosis, and it is associated with anemia, yellowing of the feces and presence of respiratory rattles, and the death may be due to asphyxia because the trachea will be full of exudates, and which will cause the blockage of air exchange and all. Coming to the cattle, in conditions of high humidity and temperature, it will enhance the growth of these molds if hay and straw is stored, which will cause the infection, because in male cattle the infection is mainly due to inhalation or ingestion of this moldy hay or straw, and it can cause lesions in the respiratory tract or ulcers. Through ingestion it can cause ulcers or some ruminitis in the gut, as well as in the, if it is inhaled, then respiratory tract infections are followed. And Aspergillus fumigatus is considered as the primary cause of mycotic abortions, but flavors, nudulans, nigerteres also associated with the abortion, and this abortion is most commonly occurs in 6 to 7 months of gestation. Okay, and there will be also raised ringworm type lesions on the skin of head and neck, and we will confuse it with dermatophytosis, but it may be like raised ringworm type lesions on the skin of head and neck. And in the chronic form it can lead to purulent vaginitis, cervicitis, endometritis, etc., and which yield to infertility. Okay, sometimes the organisms can colonize the bronchi, forming a compact spherical colony which is called a fungus ball, and these fungus balls are mainly produced by the Nigrum fumigatus. Okay, and in this picture I have shown a fungus ball in the lungs of a human. I didn't get the picture of an animal, so here from this you can compare it with the lungs of the animals. And in characteristically there will be nodular lesions. Okay, in the chronic aspergillosis I have shown a picture. See this picture, you can see nodular lesions on the lungs. Okay, these nodular lesions are one of the characteristics. So here you can see different diseases in dogs, sheep, cat and equine. To the diagnosis, it requires a continuous effort because it is one of the common contaminant of the laboratory, and it can be cultured routinely from the skin, from the variety of the healthy animals, etc. And for the confirmatory purposes, we should consider the following points. Okay, repeated isolation is needed and absence of any other pathogen, a recovery from the unexposed tissue, and demonstration of hyphae. So these are the 3 points for confirmatory diagnosis to be done in Aspergillus. So coming to the methods of diagnosis, there is direct microscopic examination where a med mount of preparation of the sputum or the nasal charge, milk or uterine discharge of either stomach contents are taken and observed under the microscope. And this diagnosis can be confirmed by the isolation of pathogen from the stomach contents of the aborted fetus and the placenta, and also the demonstration of the fungal hyphae in the fetal tissue is also very helpful in diagnosing these Aspergillus, and the demonstration of pattern of the conidiophore and stigmata by slide culture method is also important. And coming to the animal pathogenicity test, we can inoculate this species in other lab animals, and thus we can observe the lesions in that animal, and also we can perform some allergic test. So coming to the prevention, the Aspergillosis can be prevented by reducing the spore exposure to the animals, because we said that in cattle it is mainly due to inhalation and ingestion, and also removal of the potential source of spore contamination, maintaining the stress-free environment, and prophylactic use of 5-fluorocystosan inhibits the inhaled spore germination. Okay, so these are the points you can consider while prevention. And coming to the vaccines, there are many vaccines are developed, and it is mainly from the fungal elements such as cell filtrate, spores, and also modern biotechnological events have been also found out. Coming to the treatment, we can use Amphotericin B, 5-fluorocystosan. I already told you now, 5-fluorocystosan will be preventing the germination of the inhaled spores, and they can be administered orally. And another drug is a ketoconazole, which is an effective against the cutaneous as well as gastrointestinal aspergillosis. So thank you for watching this video. If you like this video, don't forget to subscribe, like, share and comment, and I hope this will be very useful for you. Thank you.